Major depressive disorder remains one of the most prevalent of the mental illnesses, with an estimated 4.8% of Canadian adults affected. MDD and its symptomology are far-reaching and potentially devastating. Common symptoms of this illness include behavioral, emotional, physical, and cognitive disturbances in those affected. Prescription antidepressants remain the first-line treatment for MDD, with the selective serotonin reuptake inhibitor class the most commonly prescribed worldwide. Despite research suggesting Canadians are more treated for MDD now than ever, prevalence of MDD has remained largely unchanged in Canada over the last 10 years. With that said, maybe it's time to consider different treatment options for those affected. Exercise has long been recognized as a protective factor against depression, but what about as a treatment option for those already diagnosed? Throughout this course, the question I aimed to discuss was, in adults with MDD, does adding daily aerobic exercise as compared to taking an SSRI alone improve depressive symptoms? To answer this question, an extensive literature search was done, and findings of a variety of RCTs indicate that aerobic exercise has demonstrated a strong positive impact on depressive symptomology for adults with MDD. Findings showed that study participants who participated in exercise at higher intensities, durations, and frequencies reaped the most benefit, but those who exercised to a lesser degree got a positive effect as well. Exercise is certainly an attractive option as a treatment for MDD, as it's accessible, affordable, and effective in a wide variety of formats for all abilities. Studies have shown that walking outdoors has had the same positive effect on MDD as any other gym equipment. Additionally, exercise promotes good overall health and can protect against heart disease, high blood pressure, and obesity, just to name a few. With these findings, the intervention created for this patient population by myself encompasses the healthcare provider making the recommendation directly to the individual patient to partake in an appropriate exercise regime. But this treatment must come as a result of a collaborative relationship between the client and healthcare provider. As a side note, current Canadian guidelines encourage adults aged 18 to 64 to participate in 150 minutes of moderate to vigorous physical activity per week as a guideline. This is the amount of exercise to be. Individual level approach targeted to the healthcare provider was chosen due in part to the nature of the beast that is major depressive disorder. Lack of taking pleasure and the lack of motivation are common emotional symptoms in MDD, as is difficulty decision making. Therefore, directness and guidance from the client's healthcare provider has been shown to be more helpful than the client navigating this intervention alone. The healthcare provider should also undertake implementing this intervention with this population as a collaborative, patient-centered one, focusing on the intervention, intercepting barriers, and individualizing an exercise regime that works for the client. With any health-related behavioral change, the largest barrier to implementing this intervention would be compliance. An estimated 50% of exercise regimes are abandoned by clients after they're recommended by their physicians. However, research has shown that clients are much more likely to comply with any behavioral lifestyle change when their healthcare provider works with them, not simply pointing a finger and telling them to exercise. To sum up, the goal of the exercise intervention is to improve depressive symptomology in patients with MDD, and therefore lower morbidity and mortality related to this mental illness. Aerobic exercise has shown itself to be a viable adjunct treatment for major depressive disorder and should be promoted as such by healthcare providers for this patient population.